Okay, I want to talk about Mounjaro and Ozempic and GLP-1s in general. I just had a female, she's a personal trainer. She has a lot of muscle mass. She is fit, she is strong. She's worked her whole life to build a body that she is really happy with. It supports her, in her life, and it's amazing. And she came in today because she wanted to talk about the anti-aging benefits of GLP-1s. She wanted to talk about microdosing and the anti-aging, anti-inflammatory benefits that we are getting with, especially tirzepatide. A lot of anti-inflammatory properties. We're seeing a lot of autoimmune concerns clear up. We're seeing skin conditions clear up. We're seeing joint pain and arthritic pains clear up with a lot of these injectables. But what she didn't know was that, the pros and cons that I go through with you guys, if someone is overweight and they are diabetic and they are inflamed, then the pro of going on these drugs obviously outweigh some of the cons or the side effects. Some of the major side effects, which we know about, is the muscle loss if you're not getting adequate protein and weight-bearing exercises, and osteoporosis or changes in your bone density. So for this lady, she thought that those side effects would be less if she was microdosing. So, on the one hand, if you're taking a small dose, then some of those side effects might not be as great. That's one of the benefits of microdosing. So she thought that taking a microdose would give her the anti-inflammatory benefit and reduce the risks of osteoporosis and muscle loss. And I said to her, you've worked your whole entire life to build a strong body, lots of muscle, strong bones, and are you willing to take this, even though it's a microdose, and offset some of those huge benefits? And so, ultimately at the end of our conversation, it was no. She decided against it. She wants to keep her muscle mass. She wants to keep her bone density. And so we talked about ways to support anti-inflammatory and anti-aging without the use of these drugs. But it always comes back to your pros and cons. A lot of people, the benefit of taking it, we know is life-changing. I've had a few follow-ups today where I'm refilling these and they are life-changing. They've lost weight, they're motivated, they feel great, their energy is great. Everything is better because of GLP-1s. So I always have these candid conversations with people. The other thing that we spoke about was the reason why a lot of people gain their weight back after. And she never really thought about it, but for those of you who are on it and you're concerned about the weight gain after, it's because of the fact that you're losing so much muscle mass, and muscle mass is your metabolic engine. And when you don't have adequate muscle mass, you don't have a strong metabolism. So if you are on these drugs and you are losing muscle, you're just becoming more of a ball of fat, and that is not metabolically active. So the second you come off these drugs, if you don't have the muscle to burn the calories, then yes, you're going to gain the weight back. So her and I spoke about the need for eating protein and the need for exercising when you are on these drugs. So for those of you, I've talked about it before, but the reason it's so important that you do eat protein when you're hungry and exercise or lift weights is because eventually when you do come off, you still want to maintain your muscles to support your metabolism. So that was